The biggest benefit is that it allows patients to access medical care in the most cost-effective and time-effective way. So patients do not need to leave their homes, or they can go locally to see a doctor that is thousands of miles away. And that is tremendous because it opens up the expertise of top doctors to the rest of the population in a way that's very accessible and very easy to access. It also allows us to do triaging more easily. I think in China, the government's really pushing this triaging where certain diseases should be treated at certain levels to alleviate the pressure that's on all the top tier hospitals. And I think that's an important part of the triaging where if through telemedicine, they can figure out where they should go. Should they go to the local hospital, or is this serious enough where they need to travel to get care? That would be tremendously helpful. And it allows, telemedicine also allows you to treat problems locally. So an example would be the local doctor working with an expert, or the local the expert talking to somebody in the community health center where the patient lives in, even the town itself, the sort of the local clinic, the community clinic, where the doctors really don't have all the expertise of say a academic health center. And they're able to pipe that expertise in through technology. And that's a much more efficient way to access that care and to triage the patients. The global telemedicine market is expected to reach $64 billion by 2021. And China is going to be at 8.2 billion. Actually triple that of the United States. So I think that, while that's a forecast, I think that does speak to the fact that China is going to be an important market for telemedicine, and that telemedicine is going to be an important technology in changing the way healthcare is delivered in China. China has a variety of advantages. I think the Chinese is especially good with building technology when it comes to software, hardware, and I think that expertise is going to come into play because they can build a system that is just really advanced and really easy to use, and that is a tremendous advantage. I think that it's important to keep in mind that the medical consultations are virtual and that you can't solve all problems. So I think it's important to know when to bring in telemedicine and what kind of support you need before and after the appointment. So in the case of international telemedicine, a lot of times patients have to come with a file, of certain completeness, so that they can have a meaningful visit. And I think in the case of triaging, it's important to, at the other end of the spectrum, it's important to understand that, to kind of have more, to understand that you're not physically seeing the patient and there might be limitations to the technology. Maybe be more conservative in your medical judgment. But I know that for sure in the United States, when patients are triaged at the other end, the results are actually quite astonishing. About 95% of all cases are correctly triaged. So I think that those who criticize telemedicine, I think the numbers sort of speak for themselves. And in the case of international telemedicine, we have companies that are able to achieve 85% improvement in outcomes with the sickest of of patients, and there are definitive cases where telemedicine have saved people's lives. So I think the benefit far outweighs the concerns, but certainly doctors do need to keep in mind that the platform is virtual and there are certain limitations to that.